because people were saying this is non-ionizing radiation, there's no possibility for an adverse biological effect, and therefore the study was designed to challenge that hypothesis. That's why it was as many hours per day, because we knew there was a limitation on how high of an exposure intensity you could go without causing a heating effect. In chemical studies, you can go higher than what is an occupational exposure limit, but here the limit is on heating. So you want to challenge the null hypothesis to the extent possible. Then, if you see an effect, what is the dose-response relationship? Because that kind of information can then be used for a quantitative risk assessment. And that's what would lead to FCC perhaps making some kind of decisions. In terms of what this means then for 5G, is that the assumption still exists. There's no reason to believe that there is an effect. That's why this study is so important. It says the null hypothesis has been disproven. Therefore, if we're going to roll out new technologies, shouldn't we know whether there are health effects before exposing the general population?
I want to quickly support this argument, and we are challenged in the way that we need to come up with exposure scenarios for the new technologies, and we are doing that, and I must admit that this would have the label 4G when we would do it today, but essentially the exposure would be very, very similar. It has slightly different modulations to account for that, but essentially it would be the same. So I think that from a scientific point of view, translation is straightforward. From a marketing or the communication point of view, that's more difficult. Say that 2G is the same as 4G or 5G.